Okay, so we've been asked a question about the hip flexors. What are the hip flexors and why might they be important? Okay, so in our example previously, we've referred to upper cross and lower cross syndrome. So if we focus in on lower cross, we can see here hip flexors at the front. Now, and in that scenario, where we've got an exaggerated lordosis, they're quite short in that situation. And I think a lot of people actually would always go to the fact that their hip flexors are short. I see that referenced a lot. Now, what are the hip flexors? Well, the ones we're going to focus on, the primary ones here, would be referred to as the iliopsoas muscles. Now, the iliopsoas muscle is made up of iliacus and psoas. There is a psoas major and a minor, but we won't go into that too much. So we have the psoas and the iliacus. Now, the psoas muscle, very importantly, comes off the back, comes off the spine. So if I get my model, so we can see here that we have our lumbar vertebra in the lumbar region, and really importantly, the psoas muscle comes off the vertebral bodies, the discs, and the transverse processes, these little bits that stick out to the side of, I believe it's T12 to L5, okay? So it's covering all the lumbar vertebra. So we can see then that the psoas muscle is going to have a direct impact on this spine. So when I'm working as a sports massage or osteopath, and people come to me with low back pain, it's not always the muscles at the back that are the problem. It could well be that it's the muscles at the front. It's actually the psoas muscle, particularly, and maybe the iliacus to some degree, pulling that spine forwards into exaggerated lordosis, cramping up that area. So you can see the importance of the hip flexors. The other hip flexor component is the iliacus muscle. Iliacus muscle, origin off the iliac fossa here, this inside surface of the ilium. Sorry, both the psoas, I didn't say, I don't think, the psoas and the iliacus come down and they insert into the femur, into the lesser trochanter of the femur. Okay, so you can see that they cross over the hip and have a big influence on what happens at the hip. Okay, so we can see the importance there in terms of if there's a problem with the hip flexors, it's going to have a big influence on this area. The other thing that the hip flexors do is that they actually provide some stability. You can see that, can't you? That they come off this area. So not only are they responsible for movement, for flexing the hip, I don't think I referred to that, but for flexing the hip or actually flexing the torso, so they're not only involved in movement, but they're involved in stability as well. So they need to be nice and strong because they'll work with core muscles, transversus abdominis and other muscles. Think of a cylinder, pelvic floor, diaphragm, transversus abdominis, multifidus, small muscles in the back. So hip flexors also contribute to stability of the lumbar spine. So they need to be functioning well. Okay, so that's the hip flexors. That's sort of what they do. Now, so the two things that can actually happen, I'm going to put this back now. So the two things we have to address here is that, so the hip flexors can get tight, they can get overactive, and we can see that in our lower cross syndrome, anterior tilt of the pelvis, hip flexors going to be tight. We want to release them, we want to stretch them. But I want you to think about this a little bit as well, is that it's not just about stretching the hip flexors, I don't think. I did think that for many years, but also we can see that if the hip flexors are tight, they're short, they're not in a very functional position, are they? If you go right back to your anatomy and physiology, you think about how actin and myosin work, the cross bridges that actually create those contractions. If the muscle is short, they're all going to be all cramped up and horrible, and you're not going to be able to contract the muscle very well because it's already in a shortened position. just like you're not going to be able to contract it very well if it's in a lengthened position. So if it's in a shortened position, we definitely need to stretch it out and try and relax that muscle to some degree. But we also need to strengthen that muscle, even though it's in a shortened position. So what we need to do is strike a balance between stretching the hip flexors, as many do, and hammer away at it, desperately trying to release their hip flexors, but we also need to strengthen the hip flexors. We also need good mobility around the hips. Right, so I'm going to bring in my model, Will, who's going to come in, and we're just going to go through a couple of exercises to reinforce those points. Okay, Will? Yeah. All good? Good to go. So if you could pop your mat down on the floor there, that would be fantastic. Okay, so we'll start. I'll take that from you, Will. That's super. We'll start with hip flexor stretch. So if we go into a sort of lunge position, classic hip flexor stretch stuff, Will, that's good. Okay, so and then come up right for me. That's super. So this is the typical hip flexor stretch, right? So you're going to push forward from the hips there, Will, and you're going to feel that stretch across the hip flexors. I think we could see that that's going to be the case, okay? Now, if we want to just maybe bring a little bit more to that stretch, what Will can also do is just do a little posterior tilt of the pelvis to just exaggerate that. So take it there and hold it there for me, Will. Yeah, so feeling that posterior tilt. Feel the greater stretch that you achieve with that. If we want to sort of take that a little bit further, we can bring the arms into it. We can take the arms above the head, okay, and we'll get a little bit more stretch through that area as well. Try not to bounce on it. Try and just hold that stretch for now. That's fantastic. Okay, and relax the arms down. That's good. So that would be like a classic hip flexor stretch. And we're trying to inhibit the hip flexors to relax those hip flexors. Okay, so Will, if you can bring your mat, and pop it against the thing. You're going to be leaning against those bars, so hope that's not too uncomfortable. But we're going to start with a little bit of, we've talked about the need to strengthen those hip flexors as well. So this is an exercise I think is very useful for that purpose. Will's going to demonstrate for me. So there we go. And up and over the block. And you can see that what's happening there is flexing of the hip. It's quite hard work. A lot of you will struggle with the flexibility required for this. Will's pretty good. The more he goes back against that wall, the more upright he tries to be, the more difficult that will become. So he can sort of progress it. He might have to sit away from the wall initially to even do the exercise, and then he'll move back towards the wall. How's that feeling, Will?
Yeah, hard.
Hard? Toughy. Okay, good stuff. All right, so if we take that away, now if you can come and we're going to move into a kneeling position facing the wall. Now, I'd sort of refer to this as kneeling hip flexor mobility exercise. That sort of describes what it is. It's probably called something, but let's just see that. So if we bring the hip round and just put the foot down for me, there we go. And again, take it back. Okay, and the other leg, and we can see that this is a nice mobility thing, right? So we're moving the hip through external and internal rotation. We're mobilizing the hip, and I really like this exercise for that reason. Now, the progression, however, this time, Will, with this foot, I want you to bring that around, bring it all, there we go. Now he's going to hold the foot up, elevate the foot off the ground, and he's going to be working those hip flexors. And I can see him grimacing at the sheer effort of that, which is, move maybe a little bit closer to the wall there. There you go, that's it. There we go. And he's going to hold that position. So there's a bit of hip flexor strength in there combined with a bit of hip mobility. That's absolutely perfect, Will. And bring that down. I'll spare you any further. So how, we would hold those positions. We try and build the endurance in those positions, how long we actually could hold that position and actually address that hip flexor strength. So a couple of exercises there for hip flexor strength, a little bit of mobility, but also we did, we inhibited our hip flexors with our stretch, a bit of posterior tilt in there. Just to make the point, on hips, while I'm on hips, we'll talk about hips more in a moment, but what we tend to find when I'm working with people with low back pain, or when people are coming into the clinic with me, what I often see is people with low back pain or people with neck pain. Gets a little bit samey, but why is that? It is because generally what I find in terms of the big picture, hips are pretty immobile. They tighten up, the muscles around the area tighten up. And we get tight hips, and I would find that on a lot of people. So these become immobile. The low back tends to then, because we've got a lack of mobility here, we get a greater requirement placed on the low back. It needs to be more mobile to compensate for the lack of mobility around the hips. So that's why they come in with low back pain. Because their low back's having to do too much. It's having to do too much rotation. It's having to do too much extension. Too much stress on the low back because of the immobility in the hips. That's why mobility for the hips is really important. We're going to show you another video on hip mobility, and we'll work through that. But just to make that point, we need to mobilize the hips. Also suggests, doesn't it, that we need to stabilize this low back, which is becoming too mobile because of the mobility that's being forced on it.